Hey there, future doctors! Today I'm diving deep into the anatomy and movements of one of the most fascinating joints in our body, the knee joint. Let's get started. The knee joint is a synovial hinge joint that primarily allows flexion and extension, but it can also do a bit of rotation and lateral movement. It's formed by the femur, tibia, and patella. These three bones work together to give us the stability and flexibility we need. First up, the bones. The femur, or thigh bone, has two rounded projections called condyles that articulate with the tibia. The tibia, or shin bone, has concave surfaces called tibial plateaus that meet the femoral condyles. The patella, or kneecap, is embedded in the quadriceps tendon and protects the front of the knee joint. Then there's the cartilage. Articular cartilage covers the ends of the femur, tibia, and the back of the patella, reducing friction and absorbing shock. The menisci are C-shaped fibrocartilaginous discs that sit on the tibial plateaus, acting as shock absorbers and providing stability. Now let's talk ligaments. The ACL, or anterior cruciate ligament, prevents the tibia from sliding out in front of the femur and controls rotational movements. The PCL, or posterior cruciate ligament, stops the tibia from sliding backward under the femur. The MCL and LCL, medial and lateral collateral ligaments, prevent the knee from buckling inward and outward, respectively. Tendons are up next. The quadriceps tendon attaches the quadriceps muscles to the patella and helps extend the knee. The patellar tendon connects the patella to the tibia, continuing the knee extension function. Don't forget the bursae. These small, fluid-filled sacs reduce friction between moving parts. Key ones include the prepatellar bursa in front of the patella and the infrapatellar bursa below it. Lastly, let's touch on muscles. The quadriceps muscle group at the front of the thigh extends the knee. The hamstring muscle group at the back of the thigh flexes the knee. The gastrocnemius, or calf muscle, also helps flex the knee. Now, onto movements. The knee mainly flexes and extends but can also internally and externally rotate when slightly flexed. Flexion is bending the knee, decreasing the angle between the thigh and lower leg. Extension is straightening the knee, increasing that angle. Internal rotation turns the tibia inward, while external rotation turns it outward. The knee's stability comes from its ligaments, menisci, muscles, and joint capsule. The ACL and PCL control forward and backward movement, while the MCL and LCL handle side-to-side stability. The menisci deepen the articulation, and the surrounding muscles, especially the quadriceps and hamstrings, control and stabilize the joint. In summary, the knee joint is a complex structure allowing for various movements and providing essential stability. Understanding its components is crucial for diagnosing and treating injuries and appreciating its role in our daily activities. Thanks for tuning in. Don't forget to like, subscribe, and hit the bell for more deep dives into anatomy. See you next time.